Om Shri Manjunathaya Namaha. Good morning, everyone. We are here in this virtual platform for an IQAC Initiative International webinar on the topic Biosparkles, Colon Cancer and Obesity, organized by Department of Biotechnology, MMK and SDM MMV College, Mysore. Let's begin the program with our prayer.
We gotta streamline these ideas. We need Grammarly.
I've got your back.
या कुन्देन्दु तुषारहारधवला या शुभ्रवस्त्रान्विता या वीणा वरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिः देवैः सदा पूजिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा न हि ज्ञानेन सदृशं श्रद्धावान् लभते ज्ञानम् सत्यमेव जयते असतो मा सद्गमया तमसो मा ज्योतिर्गमया मृत्योन्मा अमृतङ्गमया ॐ शान्ति शान्ति शान्तिः.
Thank you. First and foremost, I welcome our Dignite Principal, Professor Sainath Malligimadu, who has been an invaluable support for all the activities. I welcome our IQAC Coordinator, Srimati Sukruta KS, who is always an inspiration in organizing any event. I heartily welcome our delegate speaker, Dr. Balasubramanian Palaniappan, Professor in the Department of Clinical and Translational Sciences, School of Medicine, Marshall University, WV, USA. I welcome all the participants, faculties, and students from different academic and research institutions to the webinar. Also, I welcome my dear colleagues and beloved students for participating in the webinar. Before proceeding further, there is a small change in the feedback link. The link will be sent to the particular email ID of the participants. So I request all the participants to leave their name, institution, and email ID in the chat box or in the comment section. Thank you. Now it's my immense pleasure to introduce our delegate speaker. Dr. Palaniappan is an assistant professor in the Department of Clinical and Translational Sciences, John C. Edwards School of Medicine, Marshall University, West Virginia. He earned his PhD from the University of Madras, India in 2005 in the interdisciplinary field of zoology biotechnology. Previously, he held various positions in the academic institutions at the University of Madras and Wells University in India until 2010. He completed his postdoctoral training in the gastrointestinal physiology field at the School of Medicine, West Virginia University and Marshall University, West Virginia until 2018. Currently, Dr. Palaniappan pursues his research to understand intestinal electrolyte, sodium chloride, and nutrient glucose transport physiology in normal and disease status, specifically colon cancer and obesity and inflammatory bowel diseases. He received several awards and honors during his academic career, like a prestigious Early Stage Investigator Award from the American Gastroenterological Association during the Digestive Disease Week International Conference, and several Best Oral and Poster Presentation Awards. He has received multiple grant supports from National Institute of Health NIH as the role of principal investigator and co-investigator. He has been an American Gastroenterological Association member since 2010. He mentored several undergraduate, postgraduate, and postdoctoral level students. He is currently an editorial member of the SM Journal of Pharmacology and Therapeutics and United Journal of Pharmacology and Therapeutics and several high impact journals and HOC peer reviewer. He published more than 15 publications with high impact journals like Translational Research. With this very brief introduction, I welcome wholeheartedly Dr. Balasubramaniam for this webinar. I hand over the session to him. So please carry on the session.
Okay. Hi, good morning for everyone. I'm very happy to be part of your webinar seminars. Today, I know Sweta, Dr. Sweta very well when she was here with us in WVU in West Virginia. So I'm so happy to present my topic today. Let me share my stuff first. Okay. So you guys can see this?
Yes, sir.
You guys can see what I'm showing right now?
Yes, sir.
Okay,
it's visible.
That's what I want. Okay. So now you can see the full screen?
Yes, sir.
Okay, thank you. So as Dr. Sweta mentioned that I'm Dr. Balasubramaniam. I'm an assistant professor in Department of Clinical and Translational Sciences, School of Medicine, Marshall University. My voice is, you can clearly hear? Is that okay? My
Yes.
voice you can hear well?
Yes, sir. Everything is
I
perfect.
need to increase my volume. Okay.
No, everything is fine. Yeah.
Okay, thank you. So I'm going to talk about colon cancer and obesity. Before I start with colon cancer and obesity, I'm going to give a brief introduction about what is cancer, and then followed by what is obesity, then followed by what is colon cancer, and then how obesity is linked with colon cancer. Hope many of them, of students and other people, knows about what is cancer, but still I'm going to give a brief introductions regarding those couple of slides. So what is cancer? Cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow multiply through a process called cell division to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place. Sometimes this orderly process breaks down and abnormal or damaged cells grow and multiply when they shouldn't. These cells may form tumors, which are lumps of tissue. Tumors can be cancerous or not cancerous. It's called benign. Benign tumors in the brain can cause serious symptoms or be life-threatening because it pressures your brain tissue, which malfunction all your body nervous system. Cancerous tumors spreads into or invade nearby the tissues and can travel to distant places in the body to form new tumors, a process called metastasis. Cancerous tumors may also be called malignant tumors. Many cancers form solid tumors, but cancers of the blood, such as leukemia, generally do not. So you can see here there is a difference between normal cells and cancer cells. Cancer cells can grow without any signals received from the cells, but the normal cells will grow only if any signal comes. At the same time, its normal cells stops. It grows when it reaches or it encounters or it touches the nearby the cells, but the cancer cells not. It keeps growing. And also cancer cells need more energy, so it needs a blood supply continuously, so it allows to new blood vessels to form, but normal cells don't unless otherwise it's necessary. So it's a lot of differences. And also cancer cells takes any kind of nutrient pathways for their continuous nutrition supply for their growth, but normal cells, they follow only the specific nutrient pathway for their nutrition supply. Factors that cause cancer. Has you seen that? Several factors cause cancer. So mainly, cancer is caused by changes in DNA. Most cancer-causing DNA changes occurs in genes. That's very important for the cancer development. These changes are also called genetic changes. However, what you are seeing here, several other factors also influencing the development of cancer. Types of genes that cause cancer. There are three main types of genes. If any changes occur, contribute cancer development. That is oncogenes or proto-oncogenes, tumor suppressor genes, and DNA repair genes. These genes or these changes are sometimes called drivers of cancer. If any of these genes, any changes occurs, then it will drive the cancer development. What are proto-oncogenes? Proto-oncogenes are involved in normal cell growth and division. That's the normal one. But, however, when the genes are altered or more active than normal, they become cancer-causing genes or oncogenes. So like this. Oncogenes. What are oncogenes? Oncogenes, a DNA change can cause genes involved in normal cell growth to become oncogenes. Unlike normal genes, oncogenes cannot turn off, so they cause uncontrollable growth speed. You can remember them as an accelerator pedal in your vehicle. Okay, so if the accelerator pedal gets stuck or broken, what will happen? It keeps going. It goes uncontrollable speed. Then you will end up with an accident. Accident here is in a cancer. Next, tumor suppressor gene. What is a tumor suppressor gene? In normal cells, tumor suppressor gene prevent cancer by slowing or stopping the cell growth. DNA changes that inactivate tumor suppressor gene can lead to uncontrollable cell growth and cancer. You can remember this as a brake pedal in your vehicle. Think when you are in the highway or main speed track or somewhere else, and then you're driving your vehicle full speed. All of a sudden, you felt something's wrong, and then because the vehicle's going here and there, then you want to put a brake to make sure you are in the same track. Unfortunately, if a brake pedal is got stuck or broken, what will happen? You will end up. That's what this is, a brake. So if the brake is not working, gone, then you'll end up in the cancer. Third one is DNA repair gene. DNA repair genes are involved in fixing damaged DNA. Cells with mutations in these genes tend to develop additional mutation in the other genes and changes in their chromosomes, such as duplication and deletion of chromosome parts. Together, these mutations can cause the cells to become cancerous. What is a tumor microenvironment? So, within the tumor, cancer cells are surrounded by a various immune cells, fibroblasts, molecules, and blood vessels. What's known as a tumor microenvironment. Cancer cells can change the microenvironment, which in turn can affect how cancer grows and spread, because it's more important. If the cancer cell grows, they have to have their own environment, otherwise it cannot survive. So like then if for example, if you find some villains around the movie, what you see that they made their own people around them, not from the other people, because that people protect the head. Like this, the cancer also grows there, make their own environment for their growth. How does the immune system interact with the cancer? As I said, the microenvironment has a lot of immune cells too. So the immune cells normally what will do, it will it will identify the foreign cells or foreign pathogens, whatever else, and then try to attack and kill them or destroy them and remove from the cells, from the body. But cancer cell can avoid from the detection of the immune cells or prevent from attack. Some cancer treatments can help the immune system better detect and kill the cancer cells. Okay, what are the things causes the genetic changes? So each person cancer has a unique combination of genetic changes. Specific genetic changes may make a person's cancer more or less likely to respond to certain treatments. Genetic changes that cause cancer can be inherited or arise from certain environmental exposure. So you can see like UV radiation or some food materials, or any of the processing food what you are eating. Those are all very much influencing factor for the changes of the DNA. Genetic changes can also happen because of the error or during the cell division is occurred in the normal body. Most often, cancer cause genetic changes accumulate slowly from childhood to adulthood to senior or age old people. So that will develop slowly. The genetic changes will occur, which will cause the cancer development. That's what older people get more cancer, but nowadays even younger people also are getting more cancer because of those environmental factors. Can cancer spread? Yes. Cancer that has spread from the place where it first formed and traveled through the blood or lymph system to distant location in the body, where they exit in the vessels to form additional tumors. This is called metastasis. Through the blood vessels, it can go anywhere. So for many type of cancer, it is called stage 4 cancer. Metastatic cancer has the same name and the same type of cancer cells as the original or primary cancer. For example, if the breast cancer that forms a metastatic tumor in the lung is metastatic breast cancer, not the lung cancer. There's several types of cancers are there. One is carcinoma. Under carcinoma, there is a different type of carcinomas are there. Carcinomas are the most common type of cancer. They are formed by epithelial cells. There are many types of epithelial cells which often have a column-like shape. Adenocarcinoma is the cancer that forms epithelial cells that produce fluid, mucus, or most cancers in the breast, colon, lung, pancreas. Can you see that? So all they produce mucus layers. So if you go the colon, you can have the mucus. Pancreas is there, breast is there, stomach, lung, esophagus. These are all mucus producing epithelial cells. Those cells, if you have a cancer is formed, then you can call adenocarcinoma. Though you have a stomach cancer, lung cancer, colon cancer, but those are all technical term. Scientific term is adenocarcinoma. The second one, basal cell carcinoma, is a cancer that begins in the lower or basal layer of epidermis. This is the basal layer of epidermis. If any cancer develops from this, then this is called basal cell carcinoma. Squamous cell carcinoma is a cancer that forms squamous cells. It's in the upper layer, which is the epithelial cells that lie beneath the skin outer surface. You know that when you open your mouth and then swipe from your cheek, you can get the squamous epithelial cells. This is beneath of your skin layer. So if any cancer develops from those area, that's called squamous cell carcinoma. There is another one, transitional cell carcinoma. It's a cancer that forms in a type of epithelial tissue called transitional epithelium. This is the transitional epithelium or urothelium. You can see this ureter. So in the urothelium, where the urinary bladder, like from the kidney, it goes to the urinary bladder. So this tissue is found in the lining of the bladder, ureter, or parts of the kidney, and a few other organs. If any cancer develops in this area, it's called transitional cell carcinoma. Then there is a different other types of carcinoma, cancer that's called sarcoma. Sarcomas are the cancer that forms in bone and soft tissues, including muscle, fat, blood vessels, lymph vessels, and fibrous tissues, such as tendon and ligaments. So these are all, if any cancer develop, these are all sarcoma cancer. Of course, you do have angiosarcoma, osteosarcoma, that means it's a bone, and then now chondrosarcomas, cartilage, like that. All sarcoma, it ends with the sarcoma, and then leukemia. So you know what is leukemia means, right? It's a cancer that begins in the blood-forming tissue in the bone marrow. That's called leukemia. Then another one is called lymphoma, which is developed from the lymph nodes. Another type of cancer is called multiple myeloma. Multiple myeloma is a cancer that begins in the plasma cells. It's also from the bones. This is another type of immune cells. Multiple myeloma is also called plasma cell myeloma or Calla disease. Then melanoma. You know what is melanin means. It's just a pigment. It is there in our all bodies. Okay, if any cancer develops in that pigment tissue, that is called melanoma. So now cancer treatment. We have different type of cancer treatments are available. Hormone therapy, surgery, bone marrow, chemo, targeted radiation, immunotherapy, a lot of other therapies are. What is hormone therapy? Hormone therapy is a cancer. It's a treatment that slows or stops the growth of cancer, that uses hormones to grow and lessen the chances that cancer will return or stop or slow its growth. The hormone therapy, they are also used initial stage of breast cancer patients. Second one is surgery. When you use to treat a cancer, this is a kind of procedure in which a surgeon removes the cancer from your body. There's two types of surgeries there. One is cryosurgery and is a laser. Another one is stem cell therapies. Stem cell therapies is a transplants of stem cells produces that restore blood forming stem cells in people who have had their destroyed by high doses of chemotherapy or radiation therapy that are used to treat certain types of cancer. Even the stem cell therapy in the earlier stages of leukemia, they are using to control those cells to grow different progress of the cancer. They are slowing down or stopping that cancer development. Another one everybody knows, the chemotherapy. You know, it's a very important treatment option involving systemic drugs growth. Chemotherapy is generally effective, but chemotherapeutic agents are highly toxic and damage normal cells as well as cancer cells too. It causes severe side effects. For example, chemotherapy drug is fluorouracil 5-FU is one of the best drug using for chemotherapy to control many types of cancers. Then the next one is targeted therapy. This is a fascinating field. This is a key example of translating basic science research into clinically applicability in the development of molecular targeted therapy that you can call as a bench to bed. You know the words that mean bench, it means in the research area in your lab to the bed in the clinical side, in which cancer cell growth is inhibited by interfering with the specific molecules that necessary for tumor development. Numerous such molecular targets exist in cancer therapy, including epidermal growth factor receptor (EGFR), vascular endothelial growth factor. You know what is the vascular growth factor, endothelial factor? Vascular endothelial growth factor. It's it gives a new blood vessels. So as I said earlier, the cancer need a more nutrition supply, energy supply, so it forms its own blood vessels. If you target those particular vascular endothelial growth factor, if you inhibit it, then there is no blood vessel will form to the cancer cannot survive. It's another type of targeted uh, mediated therapy. Now we are going to see obesity. What is obesity? An unhealthy amount or a distribution of body fat in the human body is called obesity. Obesity is a disease. You must remember that. Compared to healthy weight people, overweight or obese people are greater risk for many diseases, which includes diabetes, high blood pressure, hypertension, cardiovascular diseases, stroke, and at least 13 types of cancer, as well as having an elevated risk of death from all causes. Please be healthy people, not even overweight, at least not at obesity conditions. Please keep your shape good. How do you determine you are obese or overweight? So researchers commonly use to measure known as a body mass index tool to determine if someone has obese or not. BMI is calculated by dividing a person's weight, it is in kilogram, by their height, which is in meters, squared commonly expressed as kilogram per meter square. So BMI provides a more accurate measure of obesity than weight alone. And for most people, it's a good, although imperfect, indicator of our body fatness. Many researchers still have kind of argument or controversies because it's not exactly fixing or calculating your obese or overweight or something, but we cannot ignore this. This gives at least a basic clue, understanding whether you're become overweight from the normal or you become obese is going to be or you're over obese. So this is how they are doing. Below 18.5, people are underweight. The BMI, you can calculate about your BMI right now, or go home and check your BMI and see where you're coming under in this category. You fall in this category. If it is 18.5 to 24.9, it's a healthy. If it is 20.20 above 25 to below 30 is overweight, above 30 to below 40 is obese, above 40 or higher is severely obese, which is not nice. Then how do they measure? You cannot go and measure from your hip and down your belly. Okay, that's what people do. No, I'm not a big obese, because see that you have to go with your belly button. So measurement that reflects body fat distribution as someone sometimes used along with BMI as indicators of obesity and disease risk. These measurements include waist circumference, waist to hip ratio, waist to height ratio, and fat distribution as measured by dual energy or X-ray absorptiometry, or imaging with CT scans or PET scan. These measures are used because fat distribution is increasingly understood to be relevant to disease risk. Visceral fat, very bad one. Fat that surrounds the internal organ seems more dangerous in terms of disease risk than overall fat or subcutaneous fat, the layer just under the skin. There is a statistics showing here obesity is a major and continually increasing public health concern. Since 1975, the worldwide prevalence of obesity has rapidly increased almost threefold. Obesity is a public health concern in developing and developed or developing countries, irrespective of all ages. And the World Health Organization published in 2016, 1.9 billion adults were overweight, or 650 millions are obese. The obesity rate in the US continuously climbed during COVID-19 pandemic, increased by 3% between March 2020 to March 2021. Based on the data collected between 2019 and 2020, 41.9, nearly 42% of adults in the USA have obesity. At least in our state, West Virginia, is highly competed. It means we are nearly reaching first state in obesity. It's so shame. Obesity is linked with several chronic diseases, which is like type 2 diabetes, coronary heart disease, stroke. See how many, these are all chronic diseases. Moreover, obesity is also associated with increased risk and mortality from several types of cancer, including colorectal cancer, associated with cancer progression and metastasis, and resistant to therapy. That is a major factor. I hate obesity. The treatment never works in obese people than the normal people. In 2022, a study in Frontiers in Cardiovascular Medicine found people with obesity with a higher waist to height ratio had 71% higher risk of cancer than those with lower waist to height ratios. Now we are going to see how cancer is associated with obesity. In fact, 20% of total cancer causes may be attributed to being either overweight or obesity. Human studies have demonstrated that a body weight increasing of 5 kg elevates the incidence of colon cancer by 6%. Moreover, a high BMI in patients with colon cancer has also been linked to an increased mortality rate. Remember, a rate that means now if a normal person have a colon cancer, for example, they are going to die after 10 years. But if you have obesity and the colon cancer, forget about the years. You can get so quick. Sorry to say that too. A variety of factors may contribute to obesity-induced cancer, such as metabolic factors, microbiota, or chronic inflammation, and altered levels of growth factors and hormones. However, the underlying molecular pathophysiological mechanisms and signaling pathways are yet entirely understood because of that fat, bad fat. Obesity is associated with the increased risk of patients with stage 2 and stage 3 colorectal cancer, those with a high baseline BMI, particularly men, had an increased risk of local reoccurrence. So these are the fat tissue types. Did you see that? Pathological obesity, metabolically healthy obesity, and lipodystrophy. The fat tissues is also called adipose tissue, produces excess amounts of hormones called adipokines that can stimulate or inhibit cell growth. For example, the level of an adipokine called leptin, the blood, increases with increasing body fat. And high levels of leptin can promote aberrant cell proliferation. And another adipokine called estrogen, high levels of this estrogen have been associated with increased risk of breast cancer, endometrial cancer, ovarian cancer, and some other cancers too. Another adipokine called adiponectin is a less abundant in people with obesity than in people with a healthy weight, and may have anti-proliferative effect that protect against tumor growth. That means if you have higher adiponectin, you won't get cancer because it protects the aberrant or aggressive cell growth. But obesity people, they have only less amount, which is helps for the cancer to grow. So how obesity is influenced? Can you see this slide? The obesity changes the metabolic pathways in our body, metabolic system in our body, and even epigenetic modification, which cause metabolic changes in the adipose tissue dysfunction, which is give the chronic inflammation and lipid peroxidation, gut microbiota, and some other bile acid levels will all change their DNA, which end up with cancers. Then high level of insulin or IGF-1 may promote the development of colon, kidney, prostate, endometrial cancer, and type 2 diabetes. People with obesity often have chronic inflammatory conditions such as inflammatory bowel disease and gallstone. The inflammatory bowel disease have two types. One is Crohn's disease and ulcerative colitis. It's collectively called inflammatory bowel disease. And non-alcoholic fatty liver, which cause oxidative stress, reactive oxygen species, that leads to DNA damage. Of course, it links risk of colon cancer, biliary tract, any other cancer types is developed. What are the researches being done in obesity and cancer? Many studies are exploring mechanisms that link obesity and cancer. One research area involves understanding the role of microbes that lives in the human gastrointestinal tract, collectively called gut microbiota or microbiome, in both type 2 diabetes and obesity. So both the diseases are associated with the dysbiosis and imbalance in the community of these microbiomes or microbes. For example, the gut microbiomes of people with obesity differs from or less diverse than those of people having the healthy weight. Imbalances in the gut microbiota are associated with inflammation, altered metabolism, and genotoxicity, which may in turn be related to cancer. You have to remember this gut microbiota also involves your psychological behavior and your immune system function and many other types. The gut microbiota research is now highly fascinating, is blooming a lot. It gives a lot of, but it's a complicated area to work with. Tumor microenvironment, as I said earlier, cancer makes their own, it develops their own environment. So researchers studying how obesity alters the tumor microenvironment, which favors the cancer development, which may play a role for the cancer progression. There is a one study, several studies, but I'm giving a one study. There's a mouse model show that obesity creates a competition for lipid between tumor cells and T cells, which makes the T cells less effective against fighting the cancers. The obese produce the T cells will affect the cancers very less. So the cancer escapes. This kind of microenvironment creates the cancer cells and then it grows happily. Now we are going to see colon cancer. What is colon cancer? What is actually is mean? There is a large bowel that's called large intestine, what we call, it's called bowel. Intestine we can simply call bowel. Large bowel. Different from any other organ or apparatus in our body. It is characterized by gradual biomolecular, anatomical, and microbiome changes. The entire area is protected from, this is a proximal colon and this is the distal colon, this is a rectum. These changes accounts for the different behavior of colon cancer rising from various portions of the large bowel, as well as differently sensitive to the therapy, either immunotherapy or chemotherapy, because that's very important. Colon cancer, okay, you can give any drug. No, this proximal region on the distal region, even that middle region, this area microbiome is different, and their the cancer activity also is different, so you have to treat with different type of treatments. We are seeing colorectal cancer. Colorectal carcinoma can occur in the rectum region. They're called rectal cancer too. They can also start in the colon, resulting colon cancer. Polyps, small bulbs-like structure which is present in your colon anywhere in your body. There's abnormal growth in the inner lining of the colon, and some polyps change into cancer, but mostly they don't. The knowledge about the genetic difference between right, this is right colon cancer and left colon cancer. Right colon cancer is significantly associated with microsatellite instability, or G3 or mucinous type, and BRAF mutation, and has more active immune cells, promoting an efficient immune response, while left colorectal cancer has predominantly immunosuppressive cells. CRCs, but actually you can see the left colon cancer can be what I can say, the death rate from left colon cancer is minimal than the right colon cancer, because the poor prognosis of the right colon cancer, and then the treatment efficiency is less in the right colon cancer than the left colon cancer, because during the colonoscopy or even the sigmoidoscopy, you can easily detect the colon cancer in the left colon, so you can quickly diagnose even the earlier stages. Then you can start the therapy. But the right colon cancer is little different, difficult, so it develops so rapidly, and then the treatment prognosis is very difficult, and end up the death is more higher in the right colon than the left colon. It's a heterogeneous disease. With different subtypes identified and characterized by specific molecular and morphological alteration, such as RAS or BRAF mutation and the kinase gene fusions. One of the most promising area of CRC translation research is identification, validation, and predictive and prognostic factors. Risk factors of colon cancer. There are several factors is risk factors for the development of colon cancer. However, we can change some of the risk factors to avoid the development of colon cancer from our end. At the same time, we cannot change some of the risk factors though. What are the risk factors that we cannot change? Being older, we cannot change. A person of the history of colorectal cancer, that we cannot change. A family of colorectal cancer adenomatous polyps, that we cannot change. And if any inherited syndromes are there, that also we cannot change. There's another one that called racial or ethnic background. For example, African American have highest colorectal cancer incidence than the other race of the people's colorectal cancer. And another one, type 2 diabetes. If you have, we can't stop for the development of colon cancer. What we can change? Physical activity, or you can avoid being overweight or obese. If you do the physical activity, see the good things. The physical activity increase your metabolic function, it ultimately reduce your weight, then automatically you stop your sedentary behavior. That means sitting in one chair and doing all work and not even moving your hip or even head except your fingers. So the physical activity will help all those things, which increase the adipocyte function. So the adipose tissue formation is reduced, and then you can reduce the chronic inflammation and increasing metabolic function, and the bioavailable of sex hormones, which also is one of the factor for cancer growth. So these are all very important. So do some physical activity, please. And modest weight loss can also improve that, reducing the colon cancer. Go to the doctor and find some medication or eat some healthier diet that also reduce your health, reduce your obesity or overweight, and take some certain diet. That means reduce the high red meats or stop processing meats. Now, in my 30 years back, what we ate in our country, I'm from South too. We never took processed food. We never see the processed food at all. We never heard about what is a processed food. Nowadays, everybody is going eating McDonald's, KFC. I can I don't want to say many of things. So guys are enjoying those things. Even chips, a load of chips, all have preservatives. Avoid, which kills you one day. And low blood level of vitamin D may also increase. Please go to the ground, play in the sun. The only will give you vitamin D free of cost. Of course, stop smoking and reduce your alcohol. I cannot say that stop using alcohol. I can, but nobody can listen. Nobody will listen. At least reduce your intake of alcohol. Please stop smoking. That will help not only you and your belongings and your loves. How does scientific research contribute to colorectal cancer management? Many research studies proposed many obesity factors influencing the development of colon cancer. One is inflammatory bowel disease. It's a chronic disease that leads colon cancer has been known for decades. The IBD prevalence is higher in obesity and also risk factor for colon cancer and even death. The recent study shows there's a one particular pathway called STAT2 and NF-kappa B activation which aggravates colon cancer in obesity patients. There's another study that's called netrin-1, that's called extracellular matrix protein, that the gene expression promote pro-inflammatory microenvironment that may trigger colon tumor progression and migration, that's called metastasis. A different research study proposes obese patient EPAT, excuse me, that's called epiploic adipose tissue. That's a fat which attached in the colon. It's like a finger-like projection that also promote colorectal cancer progression. Yet another study also proposed ATGL, adipose triglyceride lipase, which is used for lipid droplets utilization in your cells, that during obesity aggravates colon cancer. There's several hormones like adipokines, adiponectin, leptins, itaconate. Those are all linked to obesity and leads to colon cancer development. And also these hormones affect prognostic markers like PPA or gamma and other cells or other type of prognostic marker for colorectal cancer, even other cancers. Sorry. So this is the clinical things, how the obesity development progression in colon cancer. Overweight and obesity, which increase the recurrence of many diseases, including GI diseases, which reduce the treatment response. That's I said earlier. This obesity, even though you take a better medication, which will not give you a better results because of the obesity, will not allow the treatment to work in your body. Of course, the end is impaired outcome. There's a there's several diagnostic markers are available like carcinoembryonic antigen and polypeptide specific antigen, tumor associated glycoprotein, and several microRNAs. They are and exosomes. They are all now is a promising area of research for developing diagnostic markers to find earlier detection of you have a cancer or not. Previously, 40 to 45 years old, 40 years old, people have to do regular colonoscopy. When you reach 40 years old, go and check colonoscopy regularly so that you can find earlier stage of development. Sorry, 50 years old. I'm sorry, I back up. previously is 50 years old. Now they prepone to 45 years old. So you can go to the 45 years. So if you're reached 45 years old, go to talk to the doctor. I need to do colonoscopy. So that will prevent a lot of cancer formation, because detection is earlier in that stage is helps. So if you do colonoscopy when you reach the 45, that helps. You have any mild changes, earlier detection will helps. This kind of way is diagnostic process. There's a lot of therapies out there, targeted therapy. It's, as I told you earlier, now it's a fascinating field. One is tumor microenvironment, which includes macrophages, neutrophils, fibroblasts. They play an important role in initiation, progression, and invasion of colorectal cancer. With the drugs which enhance the immune cells to work to detect the cancer cells, differentiate from normal to other type of cancer cells. Another one is called epidermal growth factor receptor. They're targeting the specific receptor in colorectal studies. The preclinical studies indicate the type of antibody directed against EGFR, which effective addition of that's called cetuximab or arenotech refractory CRC tumor. That's a drug. So this will resensitize them, which will kill the cancer cells. This another one is drivers of oncogenesis, that is against drivers of oncogenesis. This is a highly successful strategy in target development in oncology. With this particular agent target a critical mediator of oncogenesis of the drug name called vemurafenib. It's called VEMURAFENIB, vemurafenib. This is an inhibitor of BRAF in BRAF mutated melanoma. Another one is angiogenesis. You know what is angiogenesis? VEGF, vascular endothelial growth factor, which inhibits to avoid formation of new blood vessels to the cancer cells. These are the targeted therapy. Of course, finally, you can go with the surgery. There's a different type of surgeries are there. As you see, there's left anterior resection, high anterior resection, which is now near the rectum, is above the rectum. Sigmoid colectomy, which is this is a sigmoid region. If you remove those, why these things? If you have a cancer spreads in this area, simply remove and you may reduce the effect of cancers. So these are the references I used, and thank you. And if you have any questions, I'm happy to answer for your questions. So you guys understand something? What is colon cancer and how obesity developed, and how colon cancer is developed, how obesity, colon cancer link together, and what kind of strategy the research is being doing right now and it's been done for several years. Thank you for listening. I'm sorry if I bored you guys, and sorry for the language, which sometimes I confused you guys. Please feel free to ask any questions. If I know, I can try to give you some information. Yeah. Radiation kills the cancer. Sometimes it also kills your normal cells, which means it may mutate your normal cells too. So it's still less side effects compared to chemotherapy. But mostly what they do the combined therapy, radiation as well as chemotherapy, so that you can little bit avoid more side effects.
Thank you, sir. She's asking radiation is used for treatment also. So how does it
Yeah, that's
balance?
what I'm saying. Radiation is best treatment, but it also, see, any treatment which have side effects, because you are disturbing in your normal environmental or homeostasis of your
Principal sir
body.
ಬಂದಿಲ್ಲ ಅನ್ಸುತ್ತೆ
As I said, targeted therapy, that particular target, for example, I said vascular endothelial growth factor, if you stop it, but your normal cell also sometimes needed for some areas. For example, if you get a wound, you have to have some blood supply over there to get rid of the wound. The wound have to be healed. If that time, if you have that, the wound may not heal. So you have a little bit side effect. But radiation is a good, but does have some side effects which can be avoided by treating some other combination therapy.
Yes, sir. I got it, sir. Thank you.
Yeah, thank you. Any other doubts you have, please raise your questions in the chat box, or you can directly ask through the microphone. Then I think no one is asking. Thank you very much for your valuable time in your morning, and thank you, Shweta, for inviting me to deliver my lecture to your excellent students and your environment peoples. And thank you for your management allowing me to present through webinar through the virtual. Thank you, everyone.
Om Sri Manjunathaya Namah. Om Sri Gurubhyo Namah. Rendering my respect to the lotus feet of Puja Hegdeji. Good morning to one and all present here. Of course, the resource person is having a evening program in which the SDM MMK has organized a program on biosparkles colon cancer in obesity. The Department of Biotechnology has conducted this particular program. Of course, all the life science departments are doing extremely good in the college, and this time biotechnology came forward and arranged for a intercollegiate international webinar in which they wanted to discuss biosparkles colon cancer in obesity. These days we find that the cancer has become a family problem. Everywhere we find people having one or other type of cancer, and it has been revealed by the WHO that colon cancer is the third most common cancer worldwide. So in such a situation, we have to take one sort of awareness program to all of them as far as this particular cancer is concerned. Of course, uh, all, all the statutory bodies like NSS, YRC, Rangers, and even other departments also organizing one or other way cancer awareness program. This time we have invited a very knowledgeable man, Dr. Balasubramanian Palaniappan, Assistant Professor, Department of Clinical and Trans Translation Science, Marshall University, Huntington, USA. He has kindly agreed to be with us, and he has delivering a keynote address as far as colon cancer in obesity as such. So this awareness program definitely will lead all of us in a very particular way and try to avoid the cancer problem. The basic things which we are supposed to take as though I am a layman as far as cancer is concerned, talking something about cancer is concerned, but I do agree that our lifestyle has given a plenty of opportunity for cancer to emerge in one or other way in human body as such. So to know that the lifestyle changes has to be done by each and everybody. Once we know the how colon cancer and other things arises, it is only because of obesity as such. It is, if it is being understood, then definitely the viewers, definitely they have to change their lifestyle and go according to one normal, very approved lifestyle as such. I thank Mr. Dr. Balasubramanian accepting our invitation and making this particular program as grand success. Thank you for the opportunity. I wish very all the best for the Department of Biotechnology and uh, other people connected to this online program as such. Thank you very much.